you going, Kieran? Just a follow-up session. Good, thanks, mate. Just a follow-up session from last week, just a few things we missed. So basically, just going to go through the structure of the program today. So got everything planned out. We've got squats, dumbbell bench press and chin-ups. We've got set up. We're going to do some cardio. We've got 3 different components of that. We've got the roller, we've got the exercise bike, and we've got some innovative cardio methods, which is interval training, and that's going to be done on the assault bike. We're going to start things off with a health assessment, and then we're going to do a fitness assessment. Only going to do one test today, which is the sit and reach. Yep. And then we're going to finish off with a bit of special population. So in case you did have any health conditions or anything, I can show you how we'd fix that, and then we're just going to finish off with some stretching. So I've checked to make sure with all the other personal trainers that none of them need any of the equipment this morning. I've also checked to make sure that any health and safety risks are met with any of the equipment. I've checked to make sure it's all in working order, no hazards around or anything. So we're going to start off with the pre-exercise screening. So I'm just going to get you to answer a few questions. If you have any problems, I'll just ask follow-up questions and we'll clarify anything. So I'll just get your name for me.
Kieran Eldridge.
And your date of birth?
19th of April, 1993.
You're a male?
Yep.
Has your doctor ever told you you've had a heart condition, or have you ever suffered a stroke?
No.
Do you ever experience unexplained pains in your chest at rest or during physical activity?
Nope.
No. Do you ever feel faint or have spells of dizziness during physical activity or exercise that causes you to lose balance?
No, not really.
Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
If you have diabetes type 1 or 2, have you had trouble controlling your blood glucose in the last 3 months?
No, no diabetes.
Do you have any diagnosed muscle, bone or joint problem that you've been told could be made worse by participating in physical activity?
No.
No. Now you said last session that you had a minor hamstring tear a bit over a year ago.
Yep.
You've been cleared to exercise with all of that through your physio? Cool. Do you have any other medical conditions that may make it dangerous for you to participate in physical activity?
No.
Cool. Alright, I'll just get you to sign and date that one for me. Because it was no to all those questions, we're all good to just keep going. There's a few extra stages to the health assessment that we can do if we need. The date is the 22nd. No, 21st, sorry. Great, thank you. Now, from our fitness assessment we did last week with the sit and reach test, you got a score of 27. I did some research into the normative data for healthy Australian adult males. You're actually in the excellent category, which is quite good. So it means that flexibility is not going to be a real issue to causing a risk of injury again to your hamstrings. So basically, as we go forward with your programming, we'll continue with the flexibility component, but it's not going to have to be a major focus. We'll keep retesting the sit and reach test to ensure that we're still improving in the flexibility, we're not going back, but just making sure that all the variables are the same for that test when we follow up test. Every 4 to 6 weeks probably we'll retest that one.
Sure.
Cool. So that's all I need you for today. I can do the rest by myself. Thanks a lot for all your help over the past 2 weeks. Good work, and look forward to working to you over the future.
Thank you, Freddie.
No worries, mate. Right, so keep going. So next components, basically I'm just going to talk you through the strength components for today. So basically the 3 exercises we've got is the dumbbell bench press, the chin up and the barbell back squat. So essentially the anatomy behind that, during the dumbbell bench press we've got majorly the pectoral muscles being used. So they insert through the sternum and up along the clavicle and insert into the humerus. So basically, during the dumbbell bench press, when you're pushing up, the pectoral muscles shorten, which allows the arm to come up. There's assistance from the triceps and the anterior deltoid into the in that movement, which also assists the shoulder joint to be moving and also the elbow joint to be moving. During the chin up, the major muscle being used is the latissimus dorsi, which is along your back there. So insert, it originates through your vertebrae, on your pelvis and through some of your ribs, and then inserts onto the back of your humerus again. So essentially this allows your arm to flex while you're pulling up. Again, there's assisting muscles through your biceps and through other muscles through your back, including the teres major, which also assist in the chin up movement. Finally, the barbell back squat, major muscle is the quadriceps, which some insert in the femur and some insert onto originate at the pelvis, and then all insert usually through the patella tendon, but they all insert onto the tibia, so they all cross the knee joint. Essentially, this allows extension of the hip and the knee at the same time, allowing the barbell back squat to occur. The glutes and hamstrings all play some role in the squat, which assists in the movement. Next section is the cardio physiology. So essentially in all cardio exercise, there's an increase in heart rate and blood pressure, along with other physiological factors. This is all due to an increased demand of oxygen. So because the body needs more oxygen to be supplied to the muscles during an increase in exercise intensity, this causes an increase in the heart rate, blood pressure, etc. So more blood can be pumped to the muscles and therefore more oxygen. Essentially, there's 3 different energy systems that can be used during cardio exercise. We've got the ATP-CP system, which lasts for between 0 and 10 seconds. This is maximal exercise of short distance or short duration. We've then got the lactic acid system, which goes from 10 seconds to about 90 to 120 seconds. This is again maximal exercise, however, cannot be completed for a huge period of time due to the build-up of lactic acid in the blood, which can cause fatigue of the muscles. Finally, the system which we'll be using in both the rower and the exercise bike is the aerobic system. So this is usually from 3 minutes onwards of submaximal exercise. So if you reach what's called a steady state, this is where your oxygen demands meet your oxygen expenditure. This is a phase of exercise which you can withhold for quite a long period of time. Through our innovative cardio method, which is the interval training on the assault bike, with intervals of 30 seconds work and 30 seconds rest, this would be using the lactic acid energy system due to its duration and maximal intensity. Next component is the special population. So we've got 3 different sections for those special populations. The first one being high blood pressure. So basically high blood pressure is just a high amount of force having to be passed through the arterial walls. So this can be due to high cholesterol blocking the arteries, or just a higher need for blood flow around the muscles. So high blood pressure is always occurring at rest, so blood pressure is not measured during exercise or anything when looking at high blood pressure, because obviously it'll increase. Essentially, for training somebody with high blood pressure, I'd just avoid excessive strenuous exercise, because training at too high an intensity will increase the blood pressure more, which can cause risk of injury and other issues. Basically, there's nothing to really stretch and strengthen to reduce high blood pressure. Exercise and diet is the major influencing factor for this. In terms of referrals, I would refer to a GP or a dietitian, because they'll generally be able to quite easily assist in the reduction of blood pressure. Modifications, just specifically, instead of doing say an 80 or 90% effort on the rower, I'd drop it down to a 60 or 70% just to avoid that strenuous exercise and allow for the cardio component to still be completed for them. Next is lower back pain. So lower back pain is quite common in all populations. Can be a result of multiple factors. A lot of the time it's due to glute tightness or inefficiency, so that's the main component I'd stretch and strengthen to ensure all components are met to avoid the lower back pain. I'd avoid excessive loading through the spine, so anything like a barbell back squat or anything quite heavy through the spine. So a modification to the back squat that you could complete is a trap bar deadlift, where instead of the load being through your spine, it's through your torso. So coming down, if you're lifting up from the ground, it's not actually putting any load on your spine. So that's quite a good exercise to avoid spinal loading and ensure strengthening of the lower body to allow for the reduced back pain. Finally, a knee injury. So knee injuries can occur quite commonly and can be, again, a result of various different factors. I'd avoid excessive change of direction, anything at really high intensity, especially at the beginning of the injuries. Stretching and strengthening. Again, the glutes for hip stability and majorly the quadricep muscles. So they're responsible for the flexion of the knee, which will allow for strong knee stability and also strong muscles. Modifications to exercises. I'd use a lot of resistance band training and bodyweight training where a high amount of load doesn't need to be put through the knee joint, but stability is a quite important factor for this. Thanks.